Hello and welcome to Inside Indiana Business. I'm Gary Dick. The healthcare and life sciences sectors in central Indiana account for 1 in about every 10 jobs and provide an annual economic impact of more than $80 billion. And in 2020, it was the epicenter of Indiana's response to the COVID-19 pandemic. Those are just some of the findings of a new report measuring not only the economic impact, but non-traditional impact like access to health care and quality of life. To break down those numbers and what it means for the future of the state's economy, pleased to be joined by BIOCROSSROADS CEO Patty Martin. Patty, welcome to the program.
Thanks for having me, Gary.
Absolutely. This report just out this week really unveiled some big numbers. $84 billion, the impact of life sciences and healthcare in central Indiana, a region that includes Indianapolis, neighboring counties, all the way up to Purdue and West Lafayette and IU down in Bloomington. That is a big number.
It is a big number, Gary, and we really wanted to take a look at the central Indiana region, which is about 14 counties, or not about, but it is 14 counties. And we had the opportunity to take a step back and really look at the impact directly of the sector and then its indirect benefits as well.
And when you talk about that and you look at the life sciences and traditional life sciences companies, we've got a lot here in the state of Indiana, but also the healthcare sector and the impact that the healthcare sector had in the response to COVID. That response really does permeate not just through those traditional sectors, but getting into manufacturing and retail, the technology sector, all really impacted by these two components of the economy.
Yes, we were very fortunate, Gary, and we stepped back after COVID to take a look at why we had such a favorable collaborative response to the pandemic here in Indiana. So in addition to having companies like Lilly and Roche and LabCorp here, the cooperation with the health systems and the state of Indiana really were second to none. And that doesn't happen just on a dime. It's years and years, over 100 years of investment in the sector that was able to help us provide care, vaccines, antibodies to patients here in Indiana and around the world.
Yeah, certainly Lilly took a leadership role in that area, to be sure. Patty, as you look, so many things we talk about out of this report, but I noticed the increase in the big number in terms of venture capital investment in the life sciences and these younger companies that are growing and innovating here in Indiana. How important is kind of that new generation, if you will, or that next generation of life sciences companies to the overall movement?
Gary, I know that we are very active in trying to promote and grow the life science sector for the state of Indiana. And ensuring that we have capital and talent and companies here is absolutely critical. We need to ensure that the investments in this sector continue to grow, and we're anxious to help folks inside the state and bringing others from outside the state to ensure that we really can promote this sector.
Well, talk about that, because I know that's a key kind of takeaway, if you will, that you want people to think about, is that continued investment, the life sciences, healthcare, ultra-competitive sectors, and there are communities and states and regions, not only around the country, around the world, vying for this investment. So Indiana, central Indiana, and the state more broadly, very much in a competitive situation when it comes to those future investments.
It absolutely is. And while there's a lot of investment capital around the globe right now, Indiana's in a very unique situation in that we have 3 research universities here between IU, Purdue, and Notre Dame. We have the country's largest medical school here, and we have vested both large companies and entrepreneurial companies, and those entrepreneurial companies are continuing to have spin-outs, so to speak. Yep. We have serial entrepreneurs here that are really benefiting the state.
Yeah, it's an ongoing story to be sure. Patty, as you look at, you mentioned talent earlier, and no matter what the business is, no matter what the sector is, it's a battle for talent, to keep talent here, but also attract, in many cases, from outside of the state. How important are these numbers to getting out and having people see these numbers, and also looking at the quality of life, quality of place in communities around central Indiana? How important is that to that whole talent attraction issue?
So, Gary, both of those are very important. One thing that we know about Indiana's life science sector and healthcare sector is a lot of people around the country don't know about it. And once we get the word out, they're really amazed by what we have to offer here. Everything from our FedEx hub and airport to spectacular talent that is around the state, both from the medical school and also from our companies. So this report is one way that we want to make sure that we get the word out. And so that's really important.
Yeah, hey, and before we go, this report, $84 billion, focuses on central Indiana, but that's just the central part of the state. I know you're going to be doing future reports that really expand throughout the state of Indiana.
It is. We wanted to first take a look at central Indiana and the combination of the life science sector and healthcare sectors, and we will be doing similar analyses in roughly 6 different regions around the state. So stay tuned for more, Gary.
All right. Patty Martin, the CEO of BIOCROSSROADS, brand new report on economic impact of the life sciences and healthcare. Patty, thanks for joining us. We'll see you soon.
Thanks.